Friends, as we continue to see more and more young men, young in their late 40s and 50s, who continue to have changes in their prostate-related aspects, it is important to come back to you again. At the Kokilam Dhirubhai Ambani Hospital in the Department of Urology on the second floor, that we continue to see more and more young men complaining of difficulty in passing urine, not emptying their urine well and completely, straining to pass urine at times, and find that there is always an incomplete evacuation, struggle to probably see their family doctors and look at medications to help them around. And when we look at that large aspect of change which is happening progressively, which sometimes can be agony and discomfort for many young men who probably have to go more frequently because the bladder is behaving irregularly and erratically to empty through the obstructing passage called the prostate. It is important to wake up to the phenomena that this is only a progressive change. The change will not slow down. The change is relentless, obviously silent and slow, and it could only be progressing between years and decades around. So if you're in your late 40s, 50s, and you have got a urinary complaint, which could happen even earlier or later, it is important to wake up to the phenomena that today in 2024, over the last few years, that we have traveled a path where we are identifying more people by health checkups, looking at their prostatic size changing on one side, looking at their complaints on the IPSS symptom score, and looking at the kind of flow patterns they have on uroflowmetry and checking their PSA levels as the relevant investigations and workup on symptomatology or asymptomatic. Very important to come to you and tell you that this is change which is going to progress as we become fathers to grandfathers. As age changes, the hormone changes bring about those important but silent changes where prostate can actually grow, occlude the urinary passage internally, and at some point in time, the flow will only become bad to worse. That's the time you identify that your flow is much more slower. Flow is dribbling. You don't empty your bladder. That's the time you need help. So why not wake up to the help earlier than later? For men who are in the late 40s, 50s, you need to know a urologist in your city, in your countries. I speak to you from the Kokilam and Dhirubhai Ambani Hospital in the Department of Urology to only wake you up that progression of change in the prostate, which you know by the size, that is what is measured by your sonologist, is not the only thing that we look into. We look into what is the prostate doing to the urinary flow, which at a point in time you could pass urine, speed with a great trajectory and the flow, where you could even paint on the wall. That flow has gradually gone down and is gradually going down. And this flow will go down and probably trouble all of us. So when we wake up to that kind of phenomena, it is important for you to identify that this trouble is progressive. This trouble needs to be brought to a halt. It needs to be slowed down. It needs to be brought to you as an awareness drive, at the same time treated and cured. Today that we live in an era of therapies, cure, prevention, it is important to wake up to a phenomena that the urinary bladder suffers the brunt of obstruction. We're looking at saving the bladder project. What does it mean? The urinary bladder has to fill up gradually, and it fills up more so on your behest till you allow it to fill, but it has to contract and push urine out. And in the background of an obstruction to the flow of urine, which is obviously slow, progressive, and gradual, the bladder suffers the brunt of being pushing more and more towards an obstruction or a resistance being created as a result of prostate. So the bladder has to overwork. The overwork of bladder brings about changes in the bladder. You know that by anatomical changes called saculations, trabeculations, diverticulum formation, the bladder is tiring up by contracting again and again. And this is not happening for a day or a week, not even for a month or a year. It's progressing year after year, decades after decades. And one fine day, when I, as a urologist, or my colleagues do a cystoscopy and look into the urinary passage of an occluded prostate, which is almost now on the operating table, the bladder must have suffered a brunt for years. So the bladder's suffering is a progression which is very silent. It has to work in the background of the resistance created by the prostate. In Save the Bladder project, which I did talk about before, but today I talk loud and clear, is for all men to save their bladder, because bladder is not an irreversible organ once it starts decaying and probably losing its tone and capacity and contraction powers. It's loss of sensation, lots of contraction power, loss of capability to push urine out. A lot will be related with various neurological issues, but more so commonly by the ignorance of us postponing our therapy on the lower urinary tract where the prostate is gradually occluding. So to me, a small prostate of 20-25 grams or a large prostate of 60 to 100 grams may both have not much meaning in terms of its size. More than that, it has meaning in terms of the obstruction. So it's a time, friends, to wake up to the obstruction that happens to us. It's very important to wake up that there is something called as IPSS symptom scoring. International Prostate Symptom Score. It's available online. It has got various kinds of questionnaires, which when filled up completely by you, and then when you mark yourself, you would find that you are in a mild or a moderate or a severe symptom score. That means you can score yourself for the first time and identify what is your report card. If you know your report card well, and you know that you are truthful to the report that you are actually going through, this would progressively change. If you look at the report card today, and you've got symptoms in the lower urinary passage of not passing urine well, not emptying the bladder as fast and as speedy as it was in the younger years, whatever was your age before. When you look at that, you don't empty your bladder completely. You have to strain and push urine out. All these are obstructive urinary complaints, which is resulting of the obstruction as a result of hormone change happening because the prostate is occluding. On the other side, the bladder goes through the brunting phenomena where the bladder has to work harder, work more in the background of an obstruction which is not changing, which is probably being missed out because it's a slow process. And we, busy in our schedules, morning till midnight, are missing out a change. We go in, we empty our bladder as and when we feel like, rather than when the bladder calls up for passing. So, postponement of urination, making the bladder overwork in the background of a changing prostate, is something that we're not aware of. And we make it feel quite irrelevant because at the point in time when there is a trouble, we will go to our doctors. But is there a time to go before? Is what I'm talking about. So IPSS symptom score, IPSS, International Prostate Symptom Score, is a score that would help you out. You could download from the internet, score yourself, and identify that if your scores are moderate to severe, it's time to wake up. It's time to get treated and cured before it becomes more troublesome. The trouble for the prostate will gradually happen because hormones are changing. But why make the bladder suffer the brunt of contracting erratically against a resistance? And finally, the bladder loses its power, its tone, its sensitivity, and many a times it almost becomes irreversible. It doesn't reverse after that. Once your age becomes 70, it cannot become 50 anymore. However, number of years you would clap to the cutting of the birthday cake, you're only getting less younger or older. Similarly, your bladder is only getting weaker and weaker with passing time. So friends, today I speak on this Save the Bladder project by treating your prostate in time. Very important for us. We wake up in time and treat prostates by many ways. We don't want to continue giving you medicine for years and decades if there is no result. If you exponentially continue to improve, your medications are working in your favor. But if you are on medication and not improving, it's time for us to relook the entire picture, identify why are you not improving. Why is the uroflow, the graph is going down flatter and flatter compared to a bell-shaped graph that was there when you used to pass urine with a good trajectory? Why is your bladder showing trabeculations and saculations and divertically formation on the ultrasonography? That means there's a progression of silent change where bladder may not reverse at all. I'm in an era which is called as minimally invasive therapies for prostate. When we look at prostate urethral lift, a situation where we lift the morale of the bladder by treating the outlet obstruction. So we're lifting the morale of the bladder by doing a prostate urethral lift. That means we actually prevent the occlusion of the urethra from worsening by actually taking the prostate away from the midline. So clipping it away, like you clip the sponge and the passage opens and away. That's a great minimally invasive therapy, which is wrought with no failure. In a very carefully chosen case, in 4 indications that I would talk about, a prostate urethral lift has been a wonderful kind of a picture, which men have got at the Kokila Men Hospital and with my colleagues in various cities in the country and the world. What does it mean? Men who are very young, men who have got significant prostatomegaly or prostatic enlargement, men who have got obstruction to the flow of urine on the younger side, they would not like to take medicines for decades together, knowing that the natural history of prostatism or changes in the prostate may sometimes not be easy to defy. So such patients would deserve a cure rather than continue to take medicines all their life. Number 2, those individuals who have got issues with having a poor flow still while the medications are on with their urologist and the medication has not given them a relief. Therefore, by mistake, stopped medication for a few days to a few weeks and the flow did not improve. And their IPSS symptom score actually went up in terms of the obstruction being very significant. Their ratings and their report cards look more desperate and and they're disgusting. They probably are those patients who have not improved. They've been somewhere out there while the changes are progressive inside the lower urinary tract. Such patient would benefit by a minimal invasive therapy, which as a prostate urethral lift has actually worked wonders. We actually lift your prostate away from the bladder neck, away from the midline, and the midline continues to stay open. And as a result of the open, your flow becomes good enough. Patients who are elderly, patients who are elderly and who cannot undergo a surgery because of their various comorbid conditions. Comorbid conditions could be Parkinsonism, could be various cardiac conditions, could be issues where they cannot go into a surgery only because of a lot of comorbidities, and who have got issues where the anxiety and worry is about aspects of ejaculation and aspects of erectile dysfunctions, actually could undergo a prostate urethral lift or could be looking at a minimally invasive therapy there rather than a long therapy. Patients who have got prostates anything between 25, 30, 40 grams to 60, 70 grams could be the right candidates so that we could actually lift the prostate away from the midline and probably give that flow which was there years or decades ago. And finally, those people who are on urinary catheter. Imagine you are on catheter and your urine does not come out. You can't be taken up for a surgery by your urologist in your city because of reasons not best known to me. But yes, there can't be aspects of a huge cardiac aspect where your anesthesia is not possible. So patients who are unfit for anesthesia in the yesteryears got suprapubic cystostomy to prevent a long-term catheter and possibly an infection. Today, they get a minimally invasive surgical therapy, MIST, for prostate, where we actually take the prostatic urethra opened up by doing those clips, which is called a prostate urethral lift. So friends, minimally invasive surgical therapy has come as a boon for patients who want to preserve their erectile and ejaculatory function, who are still very young in the late 40s, 50s, whose urinary flow is not very good, and they would not like to continue medication for decades because the bladder would suffer, and this is a Save the Bladder project. These individuals will benefit from a prostate urethral lift. I think it's important for us to score ourselves, identify ourselves, and probably get treated by our urologist in the best possible way around. So I look at right approach to the right individual so that we don't brush everybody with the same carpet. We do somebody a laser surgery, somebody plasma vaporizations, somebody prostate urethral lift, somebody other kinds of minimally invasive surgical therapy. And many of them undergo a gold standard by me called TURP, which has stood test of time in my career for the last 25 years. So at the end of it, as I come to a close, friends, if you're in your late 40s, 50s, 60s, 70s, and 80s, if your flow is not very good, if you are progressing on the urinary flow issues, which does not hold relevance in terms of your medicines not acting, you are missing out medications, problem only progressing, and you're not improving. I think it's time for us to wake up. It's time to wake up to a therapy where you should see your urologist and wake up. For me at the Kokilaben Dhirubhai Ambani Hospital, for a large subset of individuals who are more young, who are failing therapy, whose medicines are not improving, who are obviously anxious and worried about their sexual and ejaculatory function, who probably have a very narrow urethra where I can't continue operating for a very long time in a large or a moderate sized prostate, whose prostate is anything between 20, 25, 30 grams to 60, 70 grams, which can be dealt by a prostate urethral lift. Elderly gentlemen who cannot undergo a surgery, have a poor flow, medication does not work, and all patients with major comorbid factors who have got cardiac issues and issues where anesthesia is not possible and you have to live on a catheter. There's a way to come out of catheter when we work you up. When you work you up with a uroflowmetry and find the flow is on the lower side. When we look at a urodynamics and find that the bladder is contracting erratically morning till midnight, n number of times when you go and pass urine. It's time to relieve the bladder of the pressure that it's going through as a result of the resistance increased at the level of prostatic urethra. Friends, I was trying to bring it completely in a nutshell on an aspect of care that is available today and at the Kokilaben Hospital feels pleased to probably get more and more people cured on their prostate conditions, be it a small or a large prostate, be it a prostate which is bleeding or a cancer prostate, which we deal with a robotic radical prostatectomy. We need to make a difference, and therefore the awareness, and this awareness should go to one and all in the society today. If you are a prostate patient, if you are on medications, if you are failing therapy, if you are young and worried about your sexual and ejaculatory function, or your father is an elderly gentleman who is on a catheter and cannot come out of this catheter, it's time to wake up. It's time to take this prostate therapy head on. We need to look at them and probably treat them, cure them, watch them closely for future, and give them the life they deserve. Because at Kokilam and Dhirubhai Ambani Hospital, we look at the motto called Every Life Matters. And the attempt today at this channel is to look at every quality of life matters. To improve the quality of life day in and out, that you get better and better, is a motto that I have when I speak to you live and complete. Wishing you good luck. All the best.